Hello, everyone. I am Dr. Donna Grant Mills, Professor and Associate Dean for Student Affairs and Admissions at the Howard University College of Dentistry. Today, I will be presenting my abstract titled Bridging Social Determinants of Health Through Interprofessional Education, a Howard University Journey. In recent years, team-based care has been recognized as one of the most promising answers to critical questions facing our nation around health and healthcare outcomes. Some of these questions include: how do we reduce healthcare costs, increase access to care for everyone, especially our nation's most vulnerable? What are we willing to do to ensure health equity, improve the quality of care, enhance the patient's experience, and improve the clinician's well-being? Well, team-based practice has been proven to effectively address these questions. And to have team-based practice, we must start with interprofessional education. At Howard University, interprofessional education has progressed significantly since 1980 through a variety of combined efforts between institutional leadership, curriculum development, and academic community partnerships. Team-based collaborative approaches for educating health professionals to work in teams to improve health outcomes is a hallmark at Howard University. For more than 4 decades, students across the health science disciplines have experienced an interactive and collaborative educational space through the Healthcare Ethics course. This course introduces the health science students to ethical and bioethical issues confronting healthcare providers in the context of equitable healthcare delivery and research. In 2014, the IPE journey at Howard expanded to include international opportunities, symposiums, a simulation center, social justice, and health disparities. In 2015, at the request of the provost, a working group comprising faculty of the health and social sciences was formed to design an international curriculum for Howard University. The disciplines included dentistry, medicine, nursing, and allied health, the Simulation and Clinical Skills Center, the School of Social Work, the School of Communications, and the School of Social Work. The vision of the IPE committee is to establish a university-wide culture of collaboration among schools, colleges. In 2021, this vision was affirmed by Howard University Council of Deans with the approval of a formal annual IPE Day for students across the schools and colleges. To date, there are 17 schools, colleges, departments, and programs participating in the Howard University Annual IPE Day workshop. The workshop theme each year emphasizes social determinants of health and health equity. Learners engage in interdisciplinary activities centered around the roles, responsibilities, and teamwork essential for patient care and improving health outcomes. The experience provides interdisciplinary learners with baseline knowledge and an immersive experience on the core competencies for interprofessional collaborative practice. Throughout the years, our themes have included an integrated approach to child and adolescent health, understanding the intersection of HIV and opioid use, running the race towards health justice, introduction to mindfulness, clinician well-being, and arts, humanities, and health justice, an integrated approach to healing. 2025 marked the 10th anniversary for IPE Day. The workshop titled Interprofessional Education Case Challenge, Blended Theories for Better Health Outcomes provided a platform to help students develop a variety of skills and actively practice collaborative team-based care to include the use of one's knowledge and the knowledge of team members' expertise to address individual and population health outcomes, where students identified issues and goals, developed strategies, and practiced situation analysis. Since we began IPE Day in 2015, the average number of workshop students each year is 350. The average number of faculty facilitators each year is 28. At 10 years, 3,500 learners have been trained by 280 faculty facilitators across 12 disciplines. Learner feedback and evaluation of the overall IPE Day 2025 experience showed participants mostly agreed and strongly agreed that the activity was engaging and allowed them to practice IPE communication and navigate team dynamics. The participants mostly agreed and strongly agreed that the facilitator was engaging and prepared for the case challenge. Additionally, participants mostly agreed and strongly agreed that they learned something new about another discipline, the application of theoretical frameworks to patient care, working in teams, and they enhanced their overall interprofessional communication skill. Finally, learners shared that the best part The IPE case challenge was networking with colleagues from other disciplines, group interaction, working with others and learning new information, collaboration, the IPE workshop day presentations, and being able to bring their case to life. And so, our journey at Howard University from 1980 to the present builds on a rich legacy of academic excellence and new innovations committed to preparing the next generation of providers for their role in bridging social determinants of health to improve health outcomes. Thank you.